Dr. Veerendra Koujalagi, consulting gastroenterologist and hepatologist. Today I am here to share a few thoughts about hepatitis. So, what is this hepatitis? It is nothing but inflammation of liver. So, inflammation is nothing but swelling, redness, and altered function in any organ is termed as inflammation. So, in case of liver, it usually manifests in terms of generalized weakness, vomiting, decreased appetite, sometimes yellowish discoloration of eye and urine. So these are general symptoms of uh, hepatitis. So what are the causes of hepatitis? Hepatitis can be caused by a few viruses. Sometimes because it is called viral hepatitis. Sometimes it could be because of alcohol abuse or excessive alcohol use. It is called alcoholic hepatitis. Sometimes it may be because of metabolic disorders like diabetes and obesity. Then it is called as non-alcoholic steatohepatitis. And sometimes it could be because of autoimmune conditions called as autoimmune hepatitis. Sometimes it could be because of drugs and toxins. So drug induced or toxic induced liver injury. So coming to the viral causes, there are mainly 5 viruses which cause hepatitis: A to E, A, B, C, D, and E. A and E usually are transmitted from food and water, fecal-oral transmission. So it is because of drinking and unclean water or liquids and taking unclean food, contaminated food and water. So keeping general hygiene and food hygiene is important to avoid this. And usually when contracted can cause weakness and symptoms of hepatitis for 2 to 4 weeks, and usually recovers by their own. You require supportive therapy. B, C, and D are chronic hepatitis. They have the potential to go on chronic and cause cirrhosis and sometimes hepatocellular carcinoma or cancer of the liver. So D is a superadded infection to the B. So people who have B can sometimes get infected with D. It is less common in India. B and C are the chronic viral infections. Among this, B is more common, about 2.5 to 4% in India, and C is 0.5 to 1% in India. So these are usually transmitted by body secretions, blood. So usually transmitted by exposure to blood, like blood donation or surgery, dental procedures, and sometimes because of unprotected sex and from mother to child, and also whenever there is exchange of body fluids. The important thing about B and C is we can screen there is a long latent period before symptoms appear. So it is important to screen for this hepatitis B and C. And for hepatitis B, vaccine is available, so timely vaccination helps. So if you are negative and not vaccinated, please take hepatitis B vaccine. And treatment is available for both B and C in terms of antiviral oral medications. C can be cured with 3 to 6 months of therapy, and hepatitis B can be very well regulated with medications. Once anybody in the family is infected with hepatitis B, it is important to do family screening. So other causes, alcohol, as we know, alcohol when used in excess, that is more than 90 grams of alcohol per week, or whenever there is binge drinking, and there is associated risks like obesity, and in females even the lesser quantity like 30 to 40 grams can cause alcoholic hepatitis. Even this has the potential to go to cirrhosis and liver cancer. So the most important thing is avoid alcohol, cut alcohol, and reduce other risk factors. And the third one, which is of epidemic proportion, is now non-alcoholic steatohepatitis because of obesity and diabetes. So good control of diabetes, active and healthy lifestyle, avoid sugary drinks and food is important to control and avoid and control non-alcoholic steatohepatitis. And drugs and toxins are also becoming important causes of hepatitis. Many drugs prescribed by doctors themselves can cause hepatitis. So if such symptoms happen, the doctor has to be reported. Self-medication, over-the-counter medication, and uh, and lot of medication to improve health, general health, tend to cause this hepatitis. So be cautious of what you are putting into your body. Then autoimmune hepatitis is a rare form which can happen because your body identifies your own body structures as outsider and attacks it. So in such cases, doctor has to suspect and cause and to find out the cause and do tests, and it can be managed with medications. So the most important takeaway message is always keep a good general health, good lifestyle, avoid alcohol or drink in moderation, and always try to get vaccinated for hepatitis B, spread the awareness, and whenever detected, opt for early treatment for hepatitis B and C. Thank you. Have a nice day.